All right, let's get right into it. Today, we're talking about a genuine revolution in medicine, how we fight lung cancer. You know, for decades, this disease had such a grim outlook. But in just the last handful of years, a totally new approach has completely changed the game, bringing real hope where there used to be very little.
Look at this number, 1.8 million. Just let that sink in for a second. It's not just a statistic, it's the whole reason we're talking about this today. It really shows you the staggering scale of the challenge we're up against.
Because that's how many people lung cancer kills every single year. And to put that into perspective for you, that's more than breast, prostate, and colon cancers combined. It is the #1 cause of cancer death in the world. And that is why the breakthrough we're about to unpack is so incredibly important.
So this revolution, it definitely didn't happen overnight. I mean, look at this timeline. For decades, progress was just painfully slow. The standard treatment, chemo, was set all the way back in 1978. And for almost 30 years, that was kind of it. Then, 2005, we get the first targeted therapies, which was a big deal for patients with certain genetic markers. But look what happens in 2015. That's the pivot point. The first immunotherapy drugs get approved. And from there, the pace just explodes. Suddenly, we're seeing huge breakthroughs for small cell lung cancer, and we're even using these treatments in earlier stages of the disease. It's a whole new world.
Okay, so let's get into how this actually works. Because to really get the revolution, you have to understand the idea at its core. And honestly, it's just beautifully elegant. It's not about finding a stronger poison to kill cancer. It's about taking the brakes off our own body's natural defense systems.
The heroes of our story are these drugs called immune checkpoint inhibitors, or ICIs for short. Here's the best way to think about them. Your immune system has natural brakes, right? These checkpoints are there to stop it from going crazy and attacking healthy cells. The problem is, some cancer cells are really smart, and they've figured out how to hijack this safety system to protect themselves.
And this slide just explains it perfectly. So look at the left. That's the problem. A cancer cell puts up this protein, PD-L1, and it's basically like it's slamming on the brakes of your T cells, your immune system's soldiers. The T cell sees the enemy, but it gets the signal, nope, stand down. Now look at the right. The ICI drug swoops in and basically puts up a shield. It blocks that stand-down signal. The brake is released, and now the T cell is totally free to do its job and destroy that cancer cell. It is such a profound shift. We're not just attacking the cancer anymore. We're empowering our own bodies to win the fight.
And this wasn't just, another small step. As researchers put it, this was a true paradigm shift. For the very first time, we were systematically harnessing the incredible, built-in power of our own immune system to go after cancer.
But like in any great story, the hero's first amazing victory, well, it was quickly followed by a new, way more complicated problem. Because cancer is an incredibly cunning enemy, and it started to adapt.
And this gets us to the single most important question that scientists are totally focused on right now. So why doesn't it work for everyone? You have some patients who get these incredible, long-lasting results. I mean, just amazing. But then you have many others who either don't respond at all, or the cancer comes back after a while. It turns out, cancer fights back in some really sophisticated ways. For one, it can basically make itself invisible. It hides the very markers our T cells look for. Or it can build a kind of fortress around itself, what scientists call an immune desert, that the T cells just can't get into. It can also just wear our T cells down, exhausting them with so many signals that they just give up. And maybe the cleverest trick of all? When we block one of its brake pedals, like PD-1, the cancer just learns to use another one, like TIGIT or LAG-3, to shut the immune system down all over again.
This whole situation has led to this really useful idea of hot versus cold tumors. So a hot tumor is already inflamed, it's packed with T cells, it's basically primed for a fight. All you got to do is release the brakes. But a cold tumor, that's one of those immune deserts. Our army can't even get to the battlefield. And this is a huge insight, because it tells us that for those cold tumors, just releasing the brakes isn't enough. First, you have to figure out how to warm them up. And by the way, small cell lung cancer is a classic example of a tumor that's usually cold, which is why it's been so much harder to treat with these therapies.
But here's where the story gets really optimistic. Now that scientists understand how cancer is fighting back, they're developing this incredible new wave of smarter, stronger therapies that are designed to outmaneuver the cancer at every single turn.
Okay, first up we've got something called bispecific T-cell engagers, or BiTEs. And the analogy's perfect. They're like cellular handcuffs. So if a cancer cell is trying to hide, a bite doesn't care. One arm of the drug grabs onto a T cell, and the other arm grabs onto the cancer cell, and it physically yanks them together, forcing an attack. It's brilliant. And there's a new drug, tarlatamab, that does exactly this for small cell lung cancer. It's a huge deal.
Next up is CAR T-cell therapy. Now, this is some truly next-level personalized medicine. It's almost science fiction. We literally take a patient's own T-cells out of their body, we genetically engineer them in a lab into super-powered cancer assassins, and then we infuse this brand new army back into the patient to go hunt down the tumor. Just amazing.
And then there's TIL therapy, which is a really fascinating twist on the idea. Instead of engineering the T cells, here we find the most elite, battle-tested T cells that have already managed to get inside the tumor on their own. We take those elite soldiers out, grow them by the billions in a lab, and then send that massive amplified army back in to just overwhelm the cancer. So what you're seeing on this slide is really the big picture. We're building a whole new arsenal. It's not just about one tactic anymore. We've got the handcuffs for specific cancers. We're developing drugs to block totally different immune breaks like TIGIT and LAG3. We're even creating mRNA vaccines that act like a personalized wanted poster for a patient's unique tumor, training the immune system on exactly what to look for. It's a multi-front war now, and we're finally building the army we need to fight it.
But, the real path to a cure, it's not just about inventing more powerful drugs. It's about getting way smarter and more integrated in how we use them. The whole system of care has to evolve with the science.
And future success really seems to hang on four main pillars. First, precision, using simple blood tests to find the perfect drug for the right patient and to spot if the cancer is coming back way earlier than any scan could. Second, smart combinations, using things like radiation to turn those cold tumors hot right before we send in the immunotherapy. Third, safety. Learning how to manage the unique side effects of unleashing the immune system is absolutely crucial. And fourth, and this is a big one, global access. Making sure these incredible but expensive and complex treatments actually reach everyone who needs them.
Because, look, right now, there's a huge divide. This data is pretty stark. More than 60% of the clinical trials for these drugs happen in North America and Western Europe. Meanwhile, less than 3% happen in low and middle-income countries. This creates what people call a data desert. We don't really know how these drugs work in diverse populations, and it creates this massive barrier to access for most of the world.
So, we have come an unbelievable distance. We've gone from basically poisoning cancer to unleashing the body's own power to fight it. But that leaves us with the next grand challenge, right? It's the question that's going to define the next decade of cancer research. Now that we've let this powerful force off the leash, can we learn to guide it, to direct it precisely, and to make sure it can win the fight for every single patient every single time?